Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discuss an increased number of suicide cases in the last decade, the spread of monkeypox to the Twin Cities, and New Jersey's statewide project. Let's wrap things up. This is episode 142 for the week of July 4th. I'm Matt Moneypenny.
And I'm Albert Battistelli.
Before we get started, our diagnosis code for this week is V95.45, or spacecraft explosion injuring occupant.
Yikes.
Oh my gosh, this is a very niche.
Yeah, this has affected maybe like 4 people ever. Like, this is very, very
They're like, just in case.
specialized.
I guess it's good to err on the side of caution, but also I feel like this is not a very patriotic diagnosis code.
Well, I mean, explosions, fireworks, I don't know. Like, I can.
That's true.
Well, and with more and more like lay people going to space with like Blue Origins and like whatever Virgin and all that, like taking people up there, like I could see more and more spacecraft explosions that are injuring occupants.
Mm-hmm. It's going to be a household item pretty soon. It'll be like buying a lawnmower.
Yep. Oh, here's your ticket to space.
John Deere space rocket, ladies and gentlemen. Check out Earth from millions of miles away.
Yeah. It's crazy.
And that would obviously increase injuring. So they're just thinking far ahead. You know, they are. Give them credit. Good for them.
They're ahead of the curve.
Yep. Spacecraft explosion.
Spacecraft explosions, man. It's the thing of the future.
Anyways, let's get into it. First, we have suicide on the rise. As the U.S. government prepares to launch the new federally mandated crisis number 988 this month, a new Kaiser Family Foundation analysis reveals that the national suicide death rate has increased 12% from 2010 to 2020. They found that rates are rising faster among people of color and young individuals. For this analysis, KFF used the CDC's database to examine trends in suicide rates over time and by race and ethnicity, sex, age, and state. The analysis found that at least 480,000 people died by suicide from 2010 to 2020. Suicide death numbers and rates varied from different populations across the decade, but overall, people of color, young people, those living in rural areas, and men were impacted the most. People of color experienced both the highest suicide death numbers and the fastest increase in suicide death rates over the study period. Not a happy story right out of the gate.
No, not a great way to start. Not a great way to start, but it tracks. Just like when I'm like thinking about the last 10 years and thinking about the news and thinking about things, I'm like, I can see some sort of like mental health crisis that was going on during all of that. I mean, it's hard out there. I mean, there's always help, and so I'm glad they're launching the new 988 number so that people who are feeling this way will have at least a place to go or someone to talk to, hopefully. But man, I mean, that's hard.
There's definitely a need for the crisis number.
Yeah.
Now,
clearly.
will the follow through happen? Hopefully.
Right.
I mean,
we'll see.
I'm going to be hopeful and say that it will.
Yeah.
But I mean, it definitely needs to happen either way because the rates of suicide are up.
Yeah, 500,000 people in the last 10 years is a lot of people. All right. Next up, Twin Cities contained 2. 2 as in TOO, not 2 as in TWO. I know this is a podcast, so you can't see what I'm seeing, but I wanted to clarify. The Minnesota Department of Health, MDH, reported a presumptive case of the monkeypox virus infection in the Twin Cities area last week. Initial testing was completed on the weekend prior at the MDH Public Health Laboratory. The patient likely was exposed while traveling abroad. MDH is conducting contact tracing with local health partners to identify anyone who may be at risk due to direct close contact with the patient while infectious. The virus does not easily spread between people with casual contact, but transmission can occur through contact with infectious sores and body fluids, contaminated items such as clothing or bedding, or through respiratory droplets associated with prolonged face-to-face contact. As of June 24th, CDC reports 201 cases of monkeypox/orthopox virus in 26 other U.S. states. In recent months, more than 4,100 cases have been reported in 47 countries where the disease is not typically reported. So
so
monkeypox still a thing, still around.
It's here. It's real. It's here. We are in the Twin Cities. Oh my gosh.
Oh my gosh. 200 cases.
4,000 cases in 47 countries. I don't think that's worrisome.
No. Having just gone through a pandemic where it was like millions and millions of people very quickly, like all at once.
Right.
It's like, a day. It's like, oh, okay. Like, this is some small numbers. Not that take this threat, not that we shouldn't take things seriously. We should as a result of what we went through. But
compare because we're human.
Right.
It's not as infectious. It's
right.
probably, it seems like it might be pretty bad if you get it, but it's not.
Yeah, it sounds like you have to be like literally like touching people's open sores or like making out with them in order to get it. So, I mean, this was a prolonged face-to-face contact. That's just a fancy way of saying like quit kissing, making out with these monkeypox people.
That's true.
I mean, what else is prolonged face-to-face contact? Right?
He's not wrong. Anyways, statewide population project is next. Rutgers Center for State Health Policy has launched the New Jersey Integrated Population Health Data, or IPHD, to help address some of the state's major population health issues, such as the opioid crisis, COVID-19, and maternal and infant health. Researchers participating in the IPHD project will be able to request access to various types of health data, including information about birth, mortality, hospital billing records, and COVID-19 surveillance, to study health issues affecting New Jersey's population. So, Rutgers, Big Ten school, wow, doing big things. I like the acronym IPHD. It's pretty cool.
Yeah, I thought that was pretty interesting.
Very clever choice of words.
Yes, I like acronym. It.
Now, I wonder how much. I mean, it sounds like this is a pretty big project.
Yep.
Right. They're trying to address like 4 or 5 of the most serious health issues in the state of New Jersey.
Right.
So
I mean, one of
it goes well. I'm going to be optimistic again. Hopefully it goes well. But if it doesn't go well, maybe the reason why it wouldn't go well is because they're doing like more of a scattershot approach rather than just choosing one. But, maybe they have the capabilities to do it.
Yep. I mean, I guess any sort of information on this would be helpful. So any kind of research they can find would hopefully bring something new to the table, especially with things like the opioid crisis, which it seems like are just still so out of control. I mean, I don't know. Whatever they can bring to that, or if they can, I mean, the Center for State Health Policy. So I assume that their research projects would go towards informing health policy in their state. So I don't know. At least they're making some headway, hopefully.
Agreed. And with that, let's go to our next segment.
BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches.
Welcome to Breach Patrol. We talk about the latest breaches all across the world. Oh my God, Valor, what do we got?
I couldn't understand a word you just said. All right, prime example of supply chain breach. On June 9th, 2022, Cetera Financial Group Incorporated, a financial services group based in California, reported a data breach to the Maine Attorney General's office. 2,188 individuals nationwide were affected by the breach. According to the company, on March 16th, 2022, CFG received notice of a data breach from its printing service, R.R. Donnelly & Sons Company, RRD, that occurred between November 29th, 2021 and December 23rd, 2021. After starting its own investigation, CFG determined that there was personal information from its files present on the printer systems at the time of the data breach. These files were impacted by the RRD data breach. The sensitive personal information in CFG's files that may have been accessed and taken includes individuals' full names and social security numbers. Oh, good.
Dun, dun, dun. Social security numbers from the Attorney General's office.
Yep. Never something you want to see. Never something you want to see. Social security number on one of these stories.
I think we're going to see more and more municipalities getting breached just because their funds aren't usually going to cybersecurity in most cases.
Right.
Now, should they?
Right.
Yeah.
Absolutely.
Sure. Is there enough funds?
It's 2022, people. Yeah.
Is there enough funds? Definitely not. Nope.
No, absolutely not. No way.
For what they would need to overhaul, I mean,
Right.
it's not. It ain't great. It ain't great.
Yeah. I don't know if you've
But-
ever gone to like a local municipality, like I'm not talking specifically to you, Matt, but to the listeners. If any of you've gone to just your local city hall, but I'm telling you, it's not a bastion of cybersecurity. Like just some lady with her passwords written down on some Post-it notes. Like you're like, oh no.
Yeah, well, maybe it needs to be a bastion of cybersecurity.
It
but only
should.
time will tell. We'll see.
Yeah. Right.
I don't know. I mean, I think it comes down to maybe education, because I think there has to be some sort of cybersecurity
Right.
classes that go in high school. So then that way everyone knows, regardless of where they're at, some sort of cybersecurity, hey, I shouldn't write this password to this person's name on a piece of paper.
Correct.
I feel like that's a good idea.
That's just common sense.
But, who am I? Who am I, Albert?
Just people who work with cybersecurity on a daily basis.
No big deal. Next up, employee information leaked. An Oregon-based senior living and skilled nursing provider has had its computer network breached, affecting the personal information of some of its employees as well as some employees of affiliated entities. Avamere Health Services began sending data breach notifications to affected employees, saying that the company had determined that intermittent, unauthorized access to its networks occurred between January 19th and March 17th. The company's investigation into the incident, as well as its response, remains ongoing. We don't know what was affected in this.
Stay tuned.
Uh-oh. We don't know what was affected.
Oh, a senior living center.
News. They employ over 8,000 people and provide independent living, assisted living, memory care, skilled nursing, therapy, and rehab, and healthcare management services at 300 locations in 20 states. So this could be a pretty big breach when it's all said and done.
It could be. It's a lot.
Well, best of luck to you.
Yeah, we'll try to keep up on that. And last up, we have blatant neglect. The Federal Trade Commission announced mid-June that it has finalized an order against Cafe Press, requiring it to improve its security posture following a cybersecurity incident that the company attempted to cover up. Cafe Press is an online retailer of products such as t-shirts, bags, calendars, and mugs, which users can customize with their own graphic designs or texts. The breach came to light in 2019, and it reportedly impacted 23 million accounts. Despite repeated attempts to get the company to take proper action, Cafe Press not only failed to secure its systems, but also decided not to inform impacted customers about this and other cybersecurity incidents. The FTC announced that, per its finalized order, the company and parent companies are required to improve their security practices through the adoption of multi-factor authentication to minimize the amount of collected data and to store social security numbers encrypted. First of all, that seems like a light punishment for Cafe Press being a bunch of jerks and saying that they're not going to, actually help anybody in the situation.
Yeah, 23 million people. Yikes.
Imagine though the goal of just being like, yeah, we're not going to inform our customers this happened. Like,
what if Cafe Press took this as a marketing opportunity and released a limited t-shirt that said, I was breached.
I was breached.
Just kidding, that's not a good idea.
Yeah, don't do it, Cafe Press.
Don't do it. Don't do it.
You better do that multi-factor.
You make a lot of money, you're welcome. But
yeah. You better encrypt those social security numbers, though, folks. Come on.
What? Yeah. So what does that have to? What?
Well, I'm guessing
I don't understand. Are required to improve their security practices through the adoption of multi-factor to minimize and store. What is it? I don't think Social Security numbers deals with this case necessarily. I just think that the FTC is like, all right, we're making a ruling. We need to, harp on what people get breached by. So I think, if Social Security numbers were breached, who's entering their Social Security numbers into a t-shirt business?
There's some guy that just put his Social Security number
on a red flag.
And just wears it around. He just wears a t-shirt with his Social on it.
Yeah.
Crazy. Anyway.
And that's it for this week's wrap up of your healthcare news. I'm Matt Moneypenny.
And I'm Albert Battistelli.
And we'll see ya
next week.
Thank you for listening to the Bandage Podcast produced by eTactics.